Hi everyone, let's do a quick recap of the practical that deals with examination of the seventh cranial nerve, which is the facial nerve. Now, facial nerve, it consists of both the motor as well as the sensory root. There are a few nuclei of the motor nerve that you need to be familiar with. First is the motor nucleus, then you have the sensory nucleus, you have superior salivatory nucleus, you have the lacrimal nucleus. Now, as I told you, that motor nucleus it consists of motor as well as sensory root. So its motor supply basically supplies the muscle of the facial expression, the auricular muscles of the ear, and the stapedius muscle. So, muscles of facial expression, auricular muscles, and stapedius muscle. So, particularly the motor nucleus supplies these muscles. What about the sensory supply? So, the sensory supply of facial nerve, very common, very prominent, is the interior two-third of the tongue. So, interior two-third of the tongue, it gets its taste sensation where the chorda tympani branch of the facial nerve. The posterior one-third of the tongue gets its taste sensation from the glossopharyngeal nerve, right? And the entire tongue, its motor supply is given by the hypoglossal nerve. I hope that's clear now. So motor nucleus supplies the muscles of the facial expression, auricular muscles, and stapedius muscle. The sensory nucleus, it receives the taste fibers from the interior two-thirds of the tongue, floor of the mouth, as well as the palate. What about the superior salivatory nucleus? As it is clear from the name itself, salivatory nucleus, so salivary glands, sublingual as well as the submandibular salivary gland. Other than that, nasal and palatine glands. Then the lacrimal nucleus, it supplies the lacrimal gland. Now, if there's any irritation in the facial nerve, or it's inflamed, or there are some sort of lesions, or there's some sort of destruction or damage to the facial nerve, it can result in facial weakness. How can you localize facial weakness? Now, facial weakness could be of two types, either upper motor neuron lesion type or lower motor neuron type. So, upper motor neuron type, what happens is that the facial weakness is only on the lower half of the face. So only the lower half of the face is involved. In lower motor neuron lesion, both the upper half as well as the lower half of the face are involved. So in upper motor neuron lesion, only the lower half of the face is involved. In lower motor neuron type of lesion, both the upper as well as the lower half of the face are involved. And there'll be loss of taste, especially in the lower motor neuron type of lesion, because that's a lot more serious. There'll be loss of taste in the anterior two-thirds of the tongue. The loss of taste is known as, or if there's decreased taste is hypoacusia, and loss of taste is agusia, right? That's one thing. Now, another thing, Ramsay-Hunt syndrome and Bell's palsy. These are very common diseases that are associated with the lesions in the facial nerve. Ramsay-Hunt syndrome drew a lot of attention, especially after Justin Bieber was diagnosed with Ramsay-Hunt syndrome. And this basically what happens is that there is herpes zoster virus, which is varicella zoster virus. It normally gets reactivated in the geniculate ganglion, because of which there'll be a lower motor neuron type of lesion. So there'll be facial palsy, right, sort of Bell's palsy, and there'll be painful vesicular eruptions. You must have seen the photos of it. If not, so we can just see the photos here. You can see this is the geniculate ganglion. I hope you can see this is a geniculate ganglion, which is a ganglion in the facial nerve. Right here, you can see geniculate ganglion. So as this facial nerve is coming out of the facial canal, there will be geniculate ganglion. So if the herpes zoster virus, the varicella zoster virus, if it somehow gets in contact with the geniculate ganglion, there could be what do you call this disease? You call it Ramsay-Hunt syndrome. So let's just search that up, Ramsay-Hunt syndrome. So these are the images. Yeah, see, Justin Bieber had it, and there will be very painful vesicular eruptions as well. So this is how you can distinguish it from the Bell's palsy. In Bell's palsy, now this is acute clinical condition, lower motor neuron type of facial paralysis. There'll be hyperacusis and hypoacusia. Hypoacusia, the taste will be decreased significantly. Hyperacusis, for example, a friend of mine, her sister had a Bell's palsy, so she was saying that even the normal audible sounds, for example, the normal day-to-day sounds, even they're perceived as very high and painful sounds. So they're very loud, hyperacusis. This results from inflammation of the facial nerve in the facial canal. Now, how are you going to examine the motor part? First of all, obviously, you have to make sure your hands are sanitized. You have to approach the patient from the right hand side. You have to introduce yourself, explain the procedure, take consent, and then you have to also reassure them that they'll be completely safe during the examination. Now, if there will be some affected side, that face will be expressionless. Other than that, the eyes, they won't be closing properly. They'll be widely open. There'll be dribbling of saliva and the nasolabial fold. This is the nose. These are the lips. Here you have the nasolabial folds. They'll be flattened. For the motor part, first of all, you have to ask the patient to frown. If they're frowning, the normal wrinkles, it means their frontalis is fine. and the corrugator muscle is working fine, so they're good. If they cannot frown, there are no wrinkles, it's completely flat, their face is expressionless, it means they have some facial nerve lesion or palsy. Then, after frowning, you can ask them to smile or show their teeth. If they're smiling perfectly fine, they're good. If their mouth is drawn to the healthy side, it means that there is some sort of lesion. So, frowning and smiling done. Then, you have to ask them to shut their eyes tightly. If they can completely close their eyes and their eyelashes will be deeply buried, it means they are fine. If they cannot shut their eyes, so then the eyeballs, what happens is that they cannot shut their eyes. There's a normal phenomena of Bell's phenomena. What happens is basically whenever eyes are closed, eyelids are closed, the eyeballs they basically roll upwards and backwards. That's a normal phenomena. But naturally, if your eyelids do not close and you're willing to close your eyes, so there'll be still Bell's phenomena, but eyelids they've not completely drooped. So basically, if they can shut their eyes completely, they're well and good. If not, you can see Bell's phenomena, and or their eyelids have not completely buried into their lower eyelid. It means they have some facial nerve lesion. That's the reason whenever we're talking about the treatment of the Ramsay-Hunt syndrome, one of the treatments is also to give them, here you can see, they'll be to give them drops for their eyes, because of which what will happen is that their eyes will remain lubricated. Artificial tears during day and lubricating ointments at the night to protect the cornea. And other than that, antivirals obviously for what do you call it, Ramsay-Hunt syndrome. Other than that, there's one more thing. Okay, so frowning, smiling. Then you have to ask them to whistle. If they can whistle, well and good. If not, because in facial palsy, whistling will be impossible. You have to ask them to inflate their mouth, and you're going to tap or poke one of their cheeks, the inflated cheeks. If the air is blown out easily, it means probably facial nerve palsy. So frowning, smiling, then eyes, then whistling and inflating their mouth. For sensitive part, anterior to the thirds of the tongue, what you have to do is you have to apply the taste test. Swab on spatula of sugar for sweet, common salt for salty, citric acid for sour, and quinine for bitter. These you're going to apply, ask them to protrude their tongue, and you're going to apply on their tongues. And after every taste test, you have to obviously rinse their mouth, and best is to taste the bitter at the end because its effect is most long lasting. Also, if you look at the tongue, so here in the front, you're going to find sweet taste. At the back, the tongue is going to perceive the bitter taste. At the sides, they're going to perceive the sour as well as salty taste, right? Other than that, one more thing is sugar, sweet. So carbs, aldehydes, and ketones. For common salt or salty, who tests salty? Sodium ions basically give you the salty taste. Not test, but sodium ions give you the salty taste. Sour is given by acids, and bitter is given by alkaloids. And then you have one more umami, which is a meat like delicious taste, and that is given by glutamate amino acids or meat extracts. Loss of taste is ageusia, and in some sort of temporal lobe epilepsy, there will be hallucinations or false perceptions of taste as well as sound. So, yes, this is all that I've already told you. Just remember the nuclei, do not forget that, and do not forget the two Ramsay Hunt as well as Bell's palsy. So, that's pretty much it.